Dr. Silver, tell us what it's been like for you at Maimonides. Are you seeing a surge in hospitalizations of COVID patients? And are you treating your prostate cancer patients?
Well, thank you, Shelly. As you probably know, we were in Brooklyn at the very center of the first wave of COVID some months ago, and all beds in the hospital were converted to ICU beds. We curtailed all elective procedures at the request of the state, and it was really all hands on deck to take care of these COVID patients. All my urologists were repurposed as ICU doctors during this time. But once the state lifted the restrictions and we started doing elective procedures again, we initially started with the high risk patients, and then it opened up to the intermediate and then to the lower risk patients. And now, we've pretty much returned back to normal operations.
So what is the process now for elective surgeries and HIFU?
Well, similar to Dr. Miles' approach at his institution, we have separate streams for the COVID and non-COVID patients. COVID patients generally enter through the hospital's emergency department or through the outpatient clinics. They're rapidly tested, and then they're sent up in isolated elevators to a special ward walled off from the general hospital population. For the non-COVID patients, many of them never see the inside of the hospital. We often do the initial evaluations via telehealth. They'll come in at the same time as pre-testing for a brief examination. And then on the day of the surgery, they go to an ambulatory non-COVID area of the hospital, completely separate from the main center. And because it's outpatient, they're really only there for a few hours before they leave. So we've really separated the COVID from the non-COVID patients.
And how are the patients feeling about doing the HIFU procedure right now?
Well, what everybody seems to be looking for is to minimize their exposure to the healthcare system or to anybody outside their own COVID bubble. So HIFU is especially attractive to these patients because it's done quickly in a single session, really with minimal exposure. Unlike radiotherapy, where the patient comes in multiple times during the week, or surgery, where there's exposure to the main hospital, to multiple personnel and instrumentation. It's really a drive-by procedure at this point. And people like the ability to get in and out. It's increased tremendously in popularity because of that. People are asking for it because they've heard they can get this done and go home.
So how does HIFU differ from the other procedures that you've done, surgery and, well, radiation would be another clinic, but tell us how it's different.
So as Dr. Miles mentioned, there's really been a change in the way we conceptualize the treatment of prostate cancer. If you think about it, there's no other cancer that's treated the way prostate cancer has been traditionally. Usually, if somebody has, say, a small colon tumor, you wouldn't take out a whole colon. As he mentioned, for breast cancer, we'd be thrown out of the hospital if we removed the whole breast for breast cancer. You just wouldn't think of treating an entire organ when there's a small tumor in only one location. And so it's sort of an historical anomaly that we remove the entire prostate or irradiate the entire prostate for a prostate cancer that's located in only one location. And this is because prior to focal therapies, we really didn't have any way to do this. So now with focal therapies, we can treat only the tumor and leave the rest of the prostate alone. And as Dr. Miles mentioned, it decreases the risk of the loss of urinary control, the loss of sexual dysfunction. HIFU is absolutely non-invasive. It's outpatient. It's a one-shot procedure. It can be repeated if necessary. And you would expect that with this approach, it can minimize the side effects. And that turns out to be absolutely true. It definitely has less side effects than a total ablation or surgery or radiotherapy.
Thank you. That was great. Thank you, Doctor. Do you see the CPT code as democratizing treatments for prostate cancer, making HIFU more available?
Absolutely, Shelly, without a doubt. My hospital is charging about as much as a small car for HIFU. And, a lot of my patients are cops and firemen, and they absolutely can't afford that. That was without anesthesia. And a lot of the patients have said, you know what, I can't do that. And I had other patients, they come really from along the entire Atlantic seaboard in the Northeast and said, HIFU, no problem, just swipe the card. But now with the change in the reimbursement rules for this, I really have a whole bunch of patients lined up. They've researched all their options. They've gotten their opinions. They say, this is what I want, and I'm waiting until January to do it. Now, that includes all the patients with Medicare. As Mr. Emmert mentioned, other insurers are expected to fall in line because most of this country will follow Medicare eventually. And the list of people waiting stretches out now to about June or July.
Thank you, Dr. Silver. That's great to hear.